Secretary. Vivian Towns with MedStar Health, and comment and a question. I just want to support this woman's comments. I too was at the AIDS conference. Been dealing with AIDS policy for 20 years, and I was amazed at the new population that's being infected, and that is African American. And I think we need new strategies for that. That's my comment. My question is, you guys have indicated that sustainability is one of the criteria. Would you speak a bit about what you mean by sustainability of these programs once funding ends?
Sure. I will agree with you on HIV. I think on sustainability, we're going to probably do a better job defining what we mean, but I think the idea is that this is a relatively small amount of money. People are coming together to create something. What's going to happen when the money goes away? This is not a commitment for funding till the end of time. What's going to happen? And you're being from MedStar. It's a good opportunity to talk about some of your hospitals are facing some very different kinds of incentives. So for example, MedStar Hospital may not get paid, tell me if I have this wrong, for a readmission for certain conditions. Somebody comes in with heart failure, for example, and they come in again 2 weeks later for heart failure. They may not get paid that second admission, but they'll get paid more for that first admission. So the hospital has a little extra money to try to help keep that patient out healthy and out of the hospital. So one of the potential sustainability strategies is to team up in a fair way with some of the healthcare institutions that have different incentives and say, okay, here's the plan. We're going to use the state money for the first couple of years. We're going to show that we can help the MedStar Hospital reduce their readmissions, saving them money. And then if we can do that, then in future years, you'll provide the funding because it's saving you money. So I don't want to put you on the spot, but that's the kind of sustainability strategy that you can imagine. There's representatives here from people who aspire to create managed care organizations in Medicaid. And that's another, MedStar has one of those too. That's another potential partner, that somebody stands to make money if the patients are healthier and stay out of the hospital. That person should be thinking about being a solution in the sustainability puzzle. That's how we start to liberate money that would have otherwise been spent for paying for the complications of illness.
My name is Suzanne Schlattman. I'm with the Maryland Citizens Health Initiative and Healthcare for All Coalition, and I wanted to thank everyone again for their leadership and for creating this. I was a part of the Lorraine Sheehan Community Services and Health Coalition that worked on the alcohol tax that helped raise the money that this is going to support. We're thrilled. And we've already submitted comments on this selection and eligibility contract and benefits, so I won't waste our time with that. But I do want to make 2 points. The first being that this is a great opportunity to prepare for the full implementation of the Patient Protection and Affordable Care Act, and would encourage the state to consider areas that are expected to get the greatest gains in Medicaid enrollment, so that we can connect those who are now covered with care. I think that's a very important way to prepare our healthcare system for this great future that's ahead. Secondly, on the field of data collection, we know that we encourage you to also consider sexual orientation in the expansion of data that's being collected in addition to race and ethnicity. We know that lesbian, gay, bisexual, and transgender families are also, we need more data about how they're accessing care. They're more likely to be uninsured, and we want to make sure that they don't fall through the cracks. So thank you for your time.
Hi, I'm Bruce Baker, the Director of CHEER, Community Health and Empowerment Through Education and Research. You talked about then you were talking about using the zip code as the entry. But when we actually define the services and when we make an application, are we able to redefine our own zones? And because we know where the target neighborhoods are, or we can identify them, and how much can we fine tune that, and can they cross over different zip codes?
So those are some of the comments we're working through, so we'll put that up there. We're very aware of that question. I think that, in general, the concept is really for a contiguous geographic area. So it's hard to say, a zone is here, right? Having said that, I think we realize that people may want to target within zip codes to particular areas, and I think you'll see, without showing your hand too much, that we're going to try to figure out a strategy to accommodate that. But all the rules and everything will be very clear, and there'll be sessions to explain and answer everyone's questions when we get to them. You ask this question, and everyone who asks the question has to ask it.
I just want to suggest in response to Virginia's question that Bruce Baker and Uma are people to talk to about work to be done in the Long Branch area. Please be in touch with them, and I know hopefully they're going to be working together, and I'm sure they can use lots of help. So, thank you.
All right. Well, if that's it.
Can I just say one thing?
Yeah.
Thanks. So Ben reminded me to make this comment, and I think it's important. We want our partners to take the lead, and so we're delighted that Cheer and PCC and others are sort of taking the lead in terms of putting this proposal together. HHS is not going to submit an application on its own. We're not interested in doing that. This is all about collaborations, and we think we're very rich in collaborations in our county. We want to do this with you, so we want you to see us as a partner and a resource, but definitely as a partner at the table. And our folks are already at the table in the coalition that's been forming around this. So I just wanted to make that point. We're excited about this, but we also know that it can be indefinite. There is infinite, right? There isn't a resource for every community. We have many communities in need, so that is going to be an interesting challenge for us because everyone's going to see an opportunity, and to the degree that we can build a coalition and build a partnership where there's a place for everyone in a contiguous geographic area that we can demonstrate need, that will be our goals. Thanks.
Well, thanks. There are going to be plenty of opportunities to talk more about this program. Really, on behalf of the governor, lieutenant governor, I very much appreciate your interest and look forward to working with you. Thank you.